Major Monday, yay!
At Western Michigan University.
Hi everyone, my name is Brittany. I'm a senior here at Western studying speech pathology and audiology. I have a minor in psych and I'm originally from the Muskegon area.
Hi, I'm Laura. I'm a junior studying speech pathology and audiology with a minor in gerontology, and I'm from Rochester Hills, Michigan.
Hi, I'm Catherine. I'm a senior here studying speech pathology and audiology with a minor in psychology, and I'm from Portage, Michigan.
Right now we're in one of the classrooms over at the College of Health and Human Services. You'll also hear it referred to as the East Campus.
So it's kind of a funny story how I chose Western. I'm from Portage, Michigan. It's about 15 minutes away from here, so Western really wasn't on my radar. I wanted to go a little bit farther away. My parents actually signed me up for a campus tour, and I came and I started falling in love with it as I was on the tour. And then I went over to the Lee Honors College and talked to an advisor there. And then I somehow ended up here at the College of Health and Human Services talking to the chair of the speech pathology department, and from there I was just sold.
I chose Western because my aunt who went here took me on a tour, and something with me just clicked and made Western stand out from any other college that I had toured. And I could envision myself spending the next 4 years of my life here, and I just knew that this was where I was going to make friends, this is where I was going to get an education, this is where I could start my career, and I just knew that Western was for me.
I chose Western for the program specifically. Not every school has a speech pathology program, and even fewer have a master's program, so that really narrowed it down for me to a certain number of schools. And then once I came here, it was a place that I felt had a lot of opportunities for students. I had come from a small community, and so I wanted something bigger, something that gave me those opportunities and those experiences, but I didn't want it so huge that I was overwhelmed, just another student. So this was my happy medium, and I'm very happy that this worked out how it did.
I chose speech pathology because I used to go with my little sister to her therapist when we were younger, and I always knew that I wanted to do something in the health field, but I kind of figured the closer I got to college, you know, nursing maybe not so much, occupational therapy, not really my thing. And then I heard about speech pathology, so I took the introductory course here, and second class, I just fell in love, and I knew that that was what I wanted to do for the rest of my life.
One thing that really drew me to this program specifically was all the undergraduate research that was going on. So a lot of the professors here who are PhDs are doing a ton of research, and they were really receptive to letting undergraduate and master students join them on their projects. I went and spoke with one of my professors from my very first class I took here in speech pathology, and she just gave me a list of all the different research that was going on in the department, who was looking for research assistants, and just from there, that's how I got involved in research.
So I chose speech-language pathology because I had a personal experience with it. My younger sister was diagnosed with speech and language deficits when she was younger. So we saw what the impact was for her specifically, but then also what kind of an impact it had on our family. We went through the speech pathology process with her, and I just felt like it was amazing to see the transformation and all the change that could come and how much it helped us, our family, and her specifically. And so I just wanted the chance to give back to other families and give them that freedom as well.
So one of the biggest projects I've worked on here at Western is my honors thesis for the Lee Honors College. So how the whole process worked for me is I went and talked to some professors whose research I was interested in, ended up working on their project, just doing some data entry, helping them run the protocol. So what we were doing was just collecting normative data for the nasalence scores for the lower Michigan region. Nasalence is a measure of oral to nasal energy coming from your nose and your mouth, and you measure it with something called the nasometer. It's a plate that's placed on your face, and it measures that with 2 microphones. So we were just collecting normative data for a larger study, but it kind of branched off into my honors thesis because some of our traces, which is what the numbers represented by on our software, shows up kind of like a graph. Some of our traces were really wobbly. So for a normal population with no resonance disorders, no sign of cleft palate, who were all screened, it was kind of like, why are we seeing this? So I explored why these traces were wobbly in a normal population, what was causing that, the prevalence of that, and then I'm defending my thesis here in April.
So one of my favorite things about the program is how many options there are for students. So I knew I wanted to do speech pathology, but I wasn't 100% sure what type of population I wanted to work with, what type of setting I wanted to be in. So this field gave me the opportunity to have a lot of different options and to explore to see what really fit me, what I was interested in. So you can work in anywhere from a hospital to a rehabilitation clinic to a VA to the schools. Anywhere that you wanted to work, you pretty much had the opportunity to do that. So I really was drawn to this field because I was able to be in this field, but I didn't have to decide right then and there what I wanted to do.
So, and one of the cool resources we have here is the Cadaver Lab, so you can actually get that really hands-on experience with different speech structures and supporting structures and everything like that. And all the professors are great. They genuinely care about you, and they make an effort to get to know you and help you as much as they possibly can, and they really prepare you for grad school, which is really important. So outside of the classroom, I'm also involved in NSLA, which is the National Student Speech Language Hearing Association. And that's an organization that gives you a lot of really cool networking opportunities. You can meet other people in the professional field. There are volunteer service opportunities around in Kalamazoo as well as on campus. We have a couple of fundraisers, and this year we raised money for Cleft Line Bears, which is an organization that gives these little bears that have little cleft lips sewn into them to children with cleft palate or cleft lip, so they can kind of relate to the bears, which is really, really cute.
I personally did some summer volunteering. So I spent my summers up north in Petoskey, and what I did was I literally just emailed speech pathologists in the area and said, hi, I'm a student from Western Michigan University. I'm looking for something to do this summer related to speech pathology. And one speech pathologist emailed me back and said, oh, that's a great program. We'd love to have you come. So I actually just went to this clinic, and I observed there a couple times a week, as well as volunteered as a pragmatic partner or a game partner with some people with traumatic brain injuries.
So there's a lot of things to do, anywhere from the professional programs to volunteering. And you can also be a part of any of the other registered student organizations, or you can even work. I was lucky enough to get a job on campus, so it was really nice because I would go to class and then go to work in between my classes and then come back. So it was really convenient for me to be able to still work and provide for myself while I was going to college. So it's not something that's completely out of the question for students if that's something that they want or need to do. So now that we've had some time in the program, we know that it's a competitive program and sometimes it might seem a little scary, but we've got a couple little tips that we wanted to share with you to be successful in this program. So I have two tips. My first tip is to find a study buddy. It just makes everything a little bit better because when you're studying a lot, it's nice to have a friend there to talk it through, to help you and encourage you. And then my other one is to go to the professor office hours. They're required to have office hours, and they really do like to see us show up. So it's really nice just to go to ask questions, get things clarified, and then if you do need help, they know who you are, so they can step in and help you too.
I think that's something you should do while you're in the program, or even before then, is just observe in as many different locations as possible, because there's so much you can do with speech pathology and audiology, and there's so many different groups of people you can work with. So just explore your options, and you'll probably find something that clicks with you.
One of the things I would definitely advocate for current speech pathology students is going to the hours held by NSLA, just like a study hour, study group kind of thing. So they'll have second years there in the program and first year, so they can kind of help each other, especially the first years going through the bulk of your classes. So that's been really helpful. One other thing is definitely don't be afraid of the Cadaver Lab. So when I was coming in, I was really afraid, oh my gosh, I'm going to have to take this class, and I'm going to be in the Cadaver Lab, and I'm kind of squeamish, so I was really freaked out about it. But it was actually so helpful learning all the anatomy. You can really see what you're actually learning, and it's really not as bad as you think, so don't panic. Thanks for watching. Go West!